Dental implants are now a common option to replace missing teeth because they are a permanent option that feels and looks just similar to natural teeth. Yet, many hesitate to go through the procedure as they are anxious about the process of recovery. In this short video, we'll explore what it takes to recover after receiving dental implants. It is vital to keep in mind that each person's experiences regarding recovery can be different. The number of implants that are placed, as well as the health condition of the patient and the degree to which they follow the postoperative directions, could all influence the recovery procedure. After the surgery to implant a dental tooth, the patient may experience inflammation, pain, or bruises. It's normal and is treated by taking over-the-counter medicine for pain or applying cooling packs on the affected region. Also, it is important to avoid vigorous exercises for the first couple of days after the surgery. After surgery, patients are advised to follow a moderate diet so that they don't put excessive pressure on their implants. The foods you eat, such as yogurt soup, mashed potatoes, and smoothies, are easy to the mouth and assist in the healing process. It is essential to ensure good oral hygiene by gently flossing and brushing close to the area of the implant in accordance with the advice of your dentist. Patients could also be given antibiotics in order to avoid infection, and also a mouth rinse that can assist in the healing process. It is important to follow dental instructions for medication as well as oral health to get the most effective results. Within the next couple of months, patients are advised to gradually introduce more hard foods in their diets as implants begin to become fused to the jawbone. It is crucial to stay away from taking a bite on the implant until it is fully healed in order to avoid complications. As the process heals, it is possible that patients will need to go back to the dentist to attend follow-up appointments in order to check the progress of healing and make sure that the implants are fully integrating. It is essential to attend the appointments in order for any concerns or problems that could be arising. In the first phase of healing, the patients will be treated with temporary crowns or bridges installed over the implants in order to restore their aesthetics and functionality. They will then be replaced by permanent ones when the implants have healed completely and are fully integrated into the jawbone. The complete recovery process following implant surgery typically lasts up to a few months because implants will require time to meld with bone prior to supporting the final dental restoration. Patients must continue to maintain regular oral hygiene and have regular dental appointments to keep their implants' health and the surrounding teeth. To conclude, the healing process following dental implants is a critical process that requires patience, taking care of the implant and attention to the smallest of details. Following the dental professional's advice and maintaining a healthy oral health and making sure to attend follow-up appointments, patients will be able to expect success and be able to enjoy the advantages of having implants for years to follow.